Okay. Ready? 3, 2, 1.
This is Dr. Khan, executive plastic surgery. So I've done an end block on a patient, 5/11/23, initials AC. I cut out the scar. She had a lift done, and you can see, look at that heavy, thick scar right here. This certainly helps with the contouring. As you will see right here, this is the implant that she has. The MRI said that these were what were below the muscle, and believe it or not, it was above the muscle. And this is where you have the implant on the right and also on the left. This is how the implant was sitting. I removed all the inflamed tissue. You can see these pockets of abnormal tissue. I had to remove this in the end block fashion. And now, as you will see, as I go ahead and cut this open, let's see what shows on the inside. So the MRI said these were silicone implants. What were below the muscle. So the MRI is wrong because these were above. So as you will see, the other thing I want to point out is it's not like it's underfilled from the way it looks. So as I go ahead and cut this open, this is very common. You can actually hear how the textured implant sticks and does not allow movement. So what I'm going to do next is, as I cut this open, I'm just going to use my fingers just like around. You can see, look how thin. If I take the ruler and I put underneath, you can see it doesn't take much. So you have to be able to look at this paper thin, saran wrap thin. So the whole goal is to do it in a very pristine way without disturbing the capsule. And this is what makes it an end block. If there was even a millimeter break, now look at all this fluid around. See this? This is your gel bleed that's occurring. So look at this right here. So as I go like this, look, there's some fluid around. It's not enough to be sent. But if I go like this, see this? This is your gel bleed. This is the problem. This is the badness. And if I go take my pickup and I take this fluid off, this fluid is leaching into the body. This is the cause of all that misery and all that badness. And you know what my goal is, we're going to do a Facebook Live with Dr. Henry Dyckman. I'm going to take this fluid, I'm going to send it to Dr. Henry Dyckman, and I'm going to have him look under the electron microscope to show what this is. So that's my next project. Now these are saline implants. If I touch it, it's like a waterbed. You can see, right? So if you look at it, this fluid is slowly leaching into the body, and the cause of all, it's not enough to send to cytology. And you can see how there is on this textured saline implant, which is your Allergan 380cc implant, where you have the leaching of the silicone. And you can see, look at the capsule, some areas thin, some areas thick. If I go in around, look at this area of this yellow, right? You don't want to just take the capsule. You want to take all that tissue around, because this is all bad. And so you can see overall there's nothing impressively bad about it. We'll see what the pathologist shows. And you can see, look where this area was, where you had the clear name imprinted. You can see this is where the capsule was sitting. So the problem here right now, two problems. Problem number one, MRI said these are silicone, these are saline implants. Number two, the position. The MRI said these were below the muscle, and these were indeed what is above the muscle. So the MRI, whoever the radiologist is, needs to go back and have a look. So whatever the report is, absolutely, we take it and look at it But ultimately, only when the implant comes out, then we know definitively where exactly it was. The other thing is, having talked to so many patients, thousands, I will tell you, half of the patients do not even know if they have above or below, what number, what make, model of the implant, if it's Mentor, Allergan, or Sientra, or Megan, and they do not know, even if some patients, I did 2 days ago, she did not know if she had even saline or silicone, and we could not get her implants, the card, at least simply because they were over 33 years old, set of implants, so we could not get any data from her surgery. So again, the gold standard is the end block, no other better way. You cannot look at a capsule and conclude, well, this does not look like cancer, so I'm not going to send it. The only person who can tell that this is lymphoma or squamous cell or any other problems that are associated with is the pathologist when they stain it with CD30 and then they do the right magnification, and from their experience of having done pathology at least 5 years, then only can they conclude if it is malignant or not, benign or malignant, the histiocytic cells, macrophages, giant cell reaction, among others. So the goal here is the end block, the gold standard. What I'm going to do is I'm going to change my gloves because whatever that is in the inside, I don't want to cross-contaminate, and we will see what the left implant shows. So please please note that next Wednesday at 3 o'clock, I'm going to do a Facebook Live with Dr. Henry Dykman. He is the PhD, the doctor mind behind implants, showing clear evidence via electron microscopy and energy dispersive x-rays that the implants are leaching from day one. Now look at this. If you look at how the implant is sitting, you can see the protrusion and looks like underfilled. All right. So what I'm going to do next is, again, if I may highlight, I cut out the scar. You can see the big white scar. She had a lift. I cut out the scar so it will allow for aesthetic, contouring of the chest. So I'm going to go ahead and take this, done end block, which is the gold standard. Again, very thin. You can see how thin the capsule is. Look at how it's weeping. So this one is not as stuck. Stuck over here. Now hear this. You can see this rusty type of an appearance, and not uncommon to see what are secondary capsules that form. Because remember, the textured implants have been banned, right? And you can see, look at this rusty appearance. We'll see what the pathologist, look how paper thin this is again. If I put the ruler here, it doesn't take much if you're rushing through the surgery to cut into this and this fluid leaches out. Remember, it's the whole etiquette of the surgery where you have to preserve all of this and it does not leak into the chest, because now the patient will have that continued burden of silicone toxicity. And if I go like this, look at this, you can see the tissue. And if I go like this, it's very slimy. It's like as if I'm dealing with what is a ruptured implant. And if I go like this, right, look at this. And this is the root cause of all evil. This is your 380 Allergan as well. And full thickness removal, this actually helps with the contouring, and a capsule that I showed earlier with a secondary capsule, and we'll see what the pathologist shows. So overall, all implants are bad. If you look at the detailed analysis of the FDA highlights, including the manufacturers, by far textured implants cause the most inflammation. It is clearly mentioned in the warnings that smooth saline, smooth silicone implants, and certainly the textured ones are all associated with lymphoma, but more so with the textured implants. Implants are not safe devices. As you can see, the patients are hurting. They are not meant to be in the body forever. Some react sooner, some react later, but eventually all of them will succumb to breast implant illness. It's just a matter of time. And if you have imaging done, the take-home message from this Facebook Live is that look at the MRI. MRI said that these implants were silicone and they were below the muscle. In this case, this was saline implants above the muscle. And so there you have it. This is Dr. Khan, Executive Plastic Surgery.